Hey guys, what's up? We gotta talk about it. Y'all know how I feel about dental insurance, right? Alright. So my name is Dr. Williams. I'm a general dentist, owner of Cypress Cosmetic and General Dentistry. And I just gotta come on and talk about this because dental insurance is trash and we gotta work with it, but I gotta help y'all out a little bit. Okay. So when it comes to dental insurance, there are just some key things you got to understand, and there's no way for you to know it unless we tell you. So having dental insurance is cool. It's not the end all. If you don't have it, there's a lot of other options, but if you do, important things to pay attention to. Number one, when you're choosing a plan, is there a waiting period? Do not choose a plan that has a 6-month or 12-month waiting period. Never. Number two, you got to look at what the annual maximum is. This number is crucial. What is the maximum amount your insurance is going to cover for the year? It could be $1,000, it could be $1,500, it could be $2,000, it could be higher than that, okay? Great plans, it's higher than that. You want the highest possible, especially if you know you need dental work in that year. For example, you got an exam, you know you need a crown, or you need a root canal, or you need whatever. You can't have an annual maximum of $1,000. It's gonna max out so fast and you're gonna be paying out of pocket, sometimes paying more for the plan than what the plan is paying for you, if that makes sense. So you gotta calculate that, okay? Second thing to know, dental insurance does not pay 100% for anything except preventative. So when you say, like, it's a misnomer to say my insurance covers that or does my insurance cover that? No, it may pay a portion towards it. So what do I mean? Preventative, your exam once every 12 months, your x-rays normally once every 5 years with the same plan. They'll pay 100% of. If you have a healthy mouth cleaning, so no periodontal disease, if you get just the regular cleaning, they normally will pay that 100%. Fluoride, it depends on your age and your plan if they're going to pay for it or not, okay? Once you leave that category of preventative, we get a breakdown of what percentage they will cover for everything else. Fillings might be 80%. Normally it's 80, so they're going to pay about 80% of the cost of each filling, and you're going to be responsible for 20%. So you're going to come out of pocket, okay? Crowns, good plan, you're going to see 50, 60%. That's good. That's really good. If it's more, that's even better. But 50% at least is what you want, okay? So that means if a crown, if we're billing the insurance $850 for a crown, your insurance is going to pay $425 and you're responsible for $425, okay? So it's 50-50. Other procedures, like the bigger the procedure is, the percentage goes down. So the coverage might only be 30%. But here's where this also matters with your maximum. Let's say you need a root canal, a crown, and a filling, right? And your maximum is only $1,000. Even if your insurance is saying they're going to pay 50% of a crown, if you've used up most of your insurance on the root canal, you're not even going to get the full coverage on the crown because you've maxed out. So you want to get a plan that has enough built in that it's going to actually give you the benefits it's saying it's going to give you, okay? Another thing, I see patients do this all the time, and when we treatment plan, I put priority items at the top of your treatment plan. Reason being, as we're putting it in your treatment plan, it's calculating your insurance coverage, right? How much it's going to cover towards each procedure. A lot of patients are like, oh, let me just do the fillings first. But remember, you're going to use up a lot of your money paying for fillings. But if you need something like a root canal, when it's time to get that root canal, you're going to be out of insurance and you're going to end up paying way more money, right? And the thing is, priority-wise, a root canal outranks a filling. So you want to use the benefits up on the bigger items, get those super crucial items out of the way, and then let's say it gets to the end of the year and you've maxed out on your insurance plan, you still could afford to pay for a filling out of pocket over paying for a root canal out of pocket, okay? Additionally, let's say it's now December, you have fillings left on your treatment plan, we can wait until January when your insurance rolls over to get benefits to cover the fillings because we have more wiggle room. If it's a filling, it's a smaller cavity, we have more wiggle room versus if you need a root canal, that's a huge cavity, you might have an infection, you might have pain, it's urgent. Like you need to get that done and then you start to feel that pressure. So I just want to kind of explain a little bit about how insurance works and how we work with insurance because we don't really like insurance, but we have to work with it. It's not really always good for the patient and it's not really always good for us. And sometimes it can limit us as well, which is why I don't accept HMO plans. I only work with PPO. So, but if we're gonna work with it, I want you guys to actually be able to use it and benefit from it, okay? So I hope that this is helpful. If you have questions, please comment. Please leave out the comments, the price of dentistry, blah, blah, blah. I can't change the prices. I'm not going to change the prices. So I'm probably just going to delete your comment. So like, let's make this a productive conversation. If you actually have questions about dental insurance, then go ahead and drop them in the comments and I'll be more than happy to respond.